Hello everyone, welcome to Aanvii Hearing. Today I'm going to talk about ear effusion in children and what parents should know about it. Hearing is a vital sense that allows us to connect with the world around us. For children, it plays an even more crucial role as they embark on their journey of language acquisition. However, some children face a common issue known as ear effusion, which can potentially disrupt this critical developmental phase. In this podcast, we'll explore what ear effusion is, why it affects children more frequently, and what parents should be mindful of when it comes to their child's hearing and language development. Ear effusion, also known as middle ear effusion or Otitis media with effusion, is a condition where fluid accumulates in the middle ear. To comprehend why this happens, let's take a brief look at the anatomy of the ear. Our ears are intricate structures responsible for receiving and transmitting sound to the brain. This process involves the outer and middle ear, which absorbs and transmits sounds to the inner ear's cochlea. For this transmission to be effective, the middle ear's cavity must be adequately ventilated. Ventilation in the middle ear is maintained by a tiny tube called Eustachian tube, which connects the ear to the back of the nose. This tube allows air to flow freely, ensuring that the middle ear remains at the same pressure as the external environment. Why ear effusion is common in children? Ear effusion is particularly common in children primarily due to anatomical differences and lifestyle factors. Children have narrower and more horizontally oriented eustachian tubes compared to adults. These differences makes it easier for the tubes to become blocked, hindering proper ventilation. The adenoids located behind the nasal cavity can enlarge in childhood. When enlarged, they may contribute to eustachian tube blockage. Children are more susceptible to colds, especially in group settings like kindergartens and nurseries. These infections can further block the eustachian tubes. What are these symptoms a parent can observe? Some common signs that your child may have ear effusion are ear pain or discomfort, temporary hearing loss or difficulty hearing, frequent tugging or pulling at the ears, difficulty sleeping or changes in behavior, delayed speech or language development, balance or coordination issues. What are the effects of fluid buildup on hearing? Fluid buildup in the middle ear can result in hearing loss, typically of a mild to moderate degree, ranging from 26 to 55 decibels. This type of hearing impairment makes speech sound muffled and less clear. Imagine the experience of wearing earplugs or covering your ears with your fingers. Language development in children is a process heavily reliant on their ability to perceive and understand spoken communication around them. Unfortunately, ear effusion often coincides with this critical learning phase, potentially disrupting language acquisition. Research suggests that fluid accumulation in the ears during early childhood can have detrimental effects on language development. When to suspect a problem? Parents should be vigilant and consider the following signs that may indicate a problem related to hearing and language development in their child. If your child doesn't react as expected to various sounds or often asks what when spoken to. If your child frequently increases the volume of the television or computer. If others finds it challenging to understand your child's speech. If there's concern about a delay in your child's language development. In such cases, it's essential to seek professional evaluation, including an ear, nose, and throat examination and a hearing test, even at a young age. How to manage ear effusion in children? If ear effusion is diagnosed in your child, there are steps you can take to support their language and speech comprehension. Minimize background noise. Create a quiet environment whenever possible to help your child focus on sounds and speech. Use body language and facial expressions. Visual cues can aid understanding, so incorporate gestures and facial expressions when communicating. Inform educational staff. Make sure your child's teachers and caregivers are aware of the situation and can provide necessary support. Consult an ear, nose, and throat specialist. ENT specialists may recommend treatments such as the insertion of ventilation tubes to enhance your child's hearing. Speech language pathologist evaluation. If you have concerns about speech or language development, seek an evaluation from a speech language pathologist. Home care and prevention. You can support your child's comfort and recovery at home by encouraging proper hydration and a balanced diet to support the immune system. Avoiding exposure to secondhand smoke as it can worsen symptoms. Promoting good hand hygiene to reduce the risk of respiratory infections. Using a humidifier to keep the air moist, especially during dry seasons. Elevating your child's head while sleeping to aid fluid drainage. In conclusion, ear effusion is a common condition in children that can potentially impact their hearing and language development. While it usually resolves on its own, parents should remain vigilant for signs of hearing issues and seek professional guidance when needed. Early intervention and support can make a significant difference in ensuring a child's language development proceeds smoothly. For more information, visit our website, which is www.aanvihearing.com, or call us on 965839 5839.